Thank you, Sean. This is very impressive doing this live. It's a great honor to speak kind of in between Sean and Ali and Nind, many people that have invested so much in the infrastructure and the environment that we have here to do great research for many people in this room, and I'm excited to share some of that research. And specifically that will be about at the intersection of AI and empathy. And I'll give a brief content warning before we start. I'll share a few anonymized examples around mental illness, self-harm, and suicidal ideation. I'll only do that to illustrate the very real domain challenges as well as the solutions, and of course these are properly anonymized. And nobody asked me to do this, but this will be very easy to tie in, I think, precisely because of the environment that we have here. This is a project that was unique, that started at the eScience Institute, that was uniquely enabled by the Garvey Institute at UW, other local institutes like AI2 and local industry. And of course, everything I'm going to show is teamwork, including my PhD students, Ashish Sharma, Ina Lin, as well as UW and Stanford clinical psychologists, Dave Atkins and Adam Miner, and folks at a peer support platform, TalkLife. Over the past few weeks, you might have come across one or multiple headlines in the media. There's a lot of talk about the latest and greatest of AI, ChatGPT this, ChatGPT that. Many of these articles have focused on the opportunities, but also the risks for AI technology in mental health. And in this talk, I want to demonstrate first some of that potential, specifically how AI could help improve access and quality of mental health support, but I also want to focus on the potential risks and about the ethics that just came up earlier in the question and what can be done to mitigate those risks. And I'll emphasize, I will focus here on human-AI collaboration, not to replace anybody. In fact, in the exact research I'm about to show you, we found that the human-AI collaboration turns out to be superior to human-only or also AI-only approaches. So why do we desperately need to improve access to mental health support? Myself, maybe many people in this room are painfully aware that the need for mental health care outweighs the access to it. 1 in 5 adults have a mental illness, most do not receive treatment, and often that is because of a pervasive lack of mental health professionals. And this reality really emphasizes the role of peer support, and in this talk, this will be about how AI can help improve the quality of this peer support and make it more effective. So these peer support platforms are used by millions and millions of people today. They're a place where you can find people that might share your experience, that might share your suffering, that might understand what you're going through. And I'll talk about a particular one today called TalkLife. You see here a screenshot on the slide. It looks a lot like other social media platforms that you might have seen and used, but it's specifically for mental health support, and the mental health challenges that you see people express there really run the whole gamut of what you might imagine. In principle, these platforms could be amazingly useful. They could complement traditional forms of care, such as therapy. Unfortunately, for many people, it's really all that they have access to, whether that's for insurance reasons, social isolation, stigma. And these platforms could make interventions available to people that otherwise wouldn't have access to them. Now, the success of these platforms relies on quality support, and that involves a range of skills, but a central enabling factor is empathy. Empathy has been shown to be associated with symptom improvement and with kind of the formation of positive, successful relationships that we call alliance or rapport. And by empathy, I mean the ability to understand or feel the emotions and experiences of others. Now, let's say somebody that we call the support seeker, they share, and unfortunately so, my whole family hates me. And then the peer supporter might respond, try talking to your friends. Now, that's by far not the worst message any of us have seen on the interwebs. It just doesn't communicate empathy actively. And it's pretty common for peers to maybe a little quickly jump to telling others what actions they should take. And instead, you could express more empathy, for instance, by saying, I could imagine that that makes you feel really isolated. So interpreting what that person is going through. And underlying all the work I'm about to show you is the central hypothesis that peer supporters might express higher levels of empathy if they had access to automated, actionable, just-in-time feedback. And over the next few minutes, I'll first share how we can measure empathy that's expressed. Then we'll learn about how we can use AI techniques to see when AI is expressed in the real world, what downstream implications that has. We'll talk about how AI can, quote-unquote, generate empathy in the sense of generating text that expresses empathy. And then we'll put all of that together and see how humans and AI can collaborate on empathy expression. Now, the first important part about measuring empathy is not to let computer scientists define it. So in this work, we simply just adapted existing scales about empathy that in psychology have been studied for decades. And we had to adapt them to the kind of exclusively text-based and an asynchronous communication setting where I can't interrupt you, I can't vary my pitch. We did that and combined multiple scales to capture emotional and cognitive aspects. And I'll explain how we with the framework that we ended up with, there's three mechanisms of how empathy can be communicated. There's emotional reactions, communicating the emotions experienced after reading a post. There's interpretations, communicating the understanding of the inferred feelings and experiences of another person. And lastly, there's explorations. Do you do anything to help improve your understanding by exploring the feelings and experiences of another person? We decided for each of these that we would differentiate between not communicating that at all, doing that to a weak, relatively generic degree, or a stronger, more specific degree. And I'll share a few examples. Again, somebody might share, and unfortunately so, my whole family hates me. I don't see any point in living. Somebody might respond, let me know if you want to talk. Not the worst response, doesn't actively express empathy. I understand how you feel would be a weak interpretation. Everything will be fine. Weak emotional reaction. What happened is a generic exploration, and you can be more specific, for instance, by saying, if that happened to me, I would feel really isolated. I really hope things would improve, or I wonder if this makes you feel isolated, question mark. And then we turned these into computational prediction tasks, two of them. One, given a kind of post and a response, what's the level of empathy being expressed? So these are kind of three classification tasks. And then a second task of what we call rationale extraction. This is about recognizing which are the exact words that are communicating empathy here. Here are the regions highlighted in red and in blue. And I won't go into a lot of details, but we developed state-of-the-art methods for performing these tasks and recognizing how much empathy is being expressed in text. And then we were curious what the downstream effects of empathy are. Now, we tried really hard to capture the clinical psychology construct of empathy. It's not a given that on a social media kind of peer support platform that people on this platform would resonate with that exact construct. But it turns out that they do. And whenever empathy is being expressed, that's associated with lots of positive outcomes. So here on the x-axis, we have how much empathy is being expressed, and we find that when more empathy is being expressed, we see people liking those responses more. We see them replying more often, so we see kind of positive engagement coming from that. We also saw that whenever empathy was expressed, there was a kind of the social media equivalent of relationship formation. If you respond to me with empathy, I would be 80% more likely to follow you right after kind of starting a potential kind of longer relationship on this platform. But we also saw a lot of need for empathy training and feedback. So if you take our kind of three mechanisms, you add them up, you have a scale from 0 to 6. And even among kind of posts where people share their challenges, responses scored on average only a 1 out of 6, which isn't great. Turns out it also doesn't get better over time. People don't just kind of learn to express empathy better by being on this platform for longer times. If anything, it's the opposite. And I've learned from our clinical psychology colleagues that this is really true for therapists as well. Without deliberate practice and specific feedback, also professionals can diminish in their skills over time. So that set us on a path on kind of what we might do to give people feedback and help train people in expressing empathy. And we'll first look at that just as a task for machines, and we called that empathic rewriting, where we want to have a machine take a lower empathy post and transform it to a similar response with higher levels of empathy. And here's an example of what that could look like. Let's say somebody shares, I can't deal with this part of my bipolar, I really need help. Somebody might respond, don't worry, try to relax, is there anyone you can talk to? Again, not the worst response by far. It has this don't worry piece in here, which I've learned really is kind of a red flag. Clearly the person is already worrying, so this easily can come across invalidating. So let's say, what if a machine could help kind of adjust and edit this post by replacing don't worry with being manic is no fun. It's actually really scary. Adding an emotional reaction, I'm sorry to hear that this is troubling you, and then keeping as much as possible of the original post as well. So that's what empathic rewriting is. And we built a system that's based on reinforcement learning, a system called Partner, to do that exact task. I'll share on a high level how this works. So this system would look at a conversation between a support seeker and a peer supporter. That informs the state of the system. The system then decides which rewriting action it wants to take. So that could be replacing a sentence, adding a new sentence, and then the system gets rewards. And that's how that system is trained. And specifically, we rewarded this system for increased empathy. Of course, that's what we want to do here, but also keeping fluent English, having a coherent, kind of self-consistent response, and also being context-specific to avoid generic responses that we know people hate, like kind of, I'm so sorry to hear that you can use in absolutely any situation. I'll kind of won't share more details about the system in the favor of showing you a little demo in a second, but kind of this is a system that can perform these tasks better than the prior state of the art in natural language processing. So now let's put all of that together and see how kind of human peer supporters and kind of AI systems can collaborate on expressing empathy the most effectively. And I'll show you kind of the system that we developed, and I'll start with what the control group or the status quo looks like. So here, kind of, there's a post, you can respond to it, you're kind of greeted with an empty text box, even though it's kind of a tough task, and you can write out your response. So I'll write out my response here. Again, this is the control group that doesn't have access to feedback. And let's say for illustrational purposes, I use our red flag of don't worry, and I'll write I'm there for you. Now, here's the kind of treatment group that will contrast with that. And in that condition, peer supporters did have access to feedback. They didn't need to use it. We didn't incentivize them in any way, but they could access it. And I'll kind of show an example here. I'll first write out the exact same response. You might note the red flagging button here at the bottom. I'll come back to that in a second. I request feedback, takes about a second, and then we can display some potential feedback, displayed similarly, how kind of spell checking or grammar feedback, and the AI system catches. Maybe this don't worry isn't a great idea. You could consider replacing it with it must be a real struggle. It also recognizes there's no exploration of the other person's feelings and experiences happening here yet. So it also suggests adding, have you tried talking to your boss? So I'll blow this up, kind of now what could a peer supporter do? They could kind of click on replace and insert. They could, maybe they don't like the feedback or they like it so much they want more, so you can reload the feedback as well. You can ignore the feedback. You can edit before and after and so on. And then we performed a randomized control trial to figure out whether this is actually any helpful. And we worked with actual peer supporters from this Talk Live platform, 300 of them in a fully remote RCT. We randomly divided into these two conditions, kind of the status quo, you write that on your own and you don't get any feedback, or the treatment group that had access to feedback. Of course, the primary outcome is the level of empathy being expressed. And one thing that's really important here is we actually set up ourselves up in a really conservative way. We didn't want to measure, oh, is kind of the use of that AI system kind of any useful? But what we did is we trained everybody just before this study on kind of traditional means of empathy. So we would show people a screen with definitions of empathy, the mechanisms of empathy, different examples, but kind of a static way how you would do that today. So if on the next slide we see any differences between treatment and control group, what that would mean is that this kind of just-in-time, very context-specific feedback is actually helpful beyond this generic training, even if we literally trained you, 3 minutes ago. Of course, I wouldn't set it up if the result wasn't positive, but whether you ask human peer supporters on the left or machines on the right-hand side, both agree that in the treatment condition, substantially more empathy is being expressed, about 20% more. It was about double that for people that actually find it challenging to support others empathically. The participants, kind of 77% wanted that system deployed, and it's still far from perfect. 60% found the feedback actionable and helpful. And one thing that was really meaningful to us was that 69% said, I feel more confident now after this feedback in supporting others, and kind of empowering peer supporters with these systems is, of course, what we're after here. And it suggests that there could be kind of training effects of using these systems in the future as well. Now, I mentioned we didn't incentivize people at all to use this feedback. Kind of that's likely how systems like that would be used in the future. So they have to be kind of good enough for people to actually want to use them. And people use them in a variety of different ways. Some people chose never to use them. Some people used it a lot. And here on the x-axis, there's kind of different clusters of how people use the system, from not using it ever, even though they could on the left, to using it kind of basically all the time on the right. One thing that's really interesting is that the more people use the system, the more empathy they expressed as well. And these are quite massive effect sizes. Now, of course, there's selection effects here. People on the right might be particularly motivated and interested in doing that. People on the left might have been unfortunate and just not gotten the best feedback that we could generate. But it was very interesting to see kind of the striking dose-response type relationship nevertheless. So over the past few minutes, I hope that I was able to convince you at least of some of the potential and the potential benefit and opportunity for AI technology in mental health. But of course, AI technology in mental health creates lots of risk, and we had a question about that earlier as well. And of course, in whatever we do here, the safety and welfare of participants has to come first. Any potential needs need to be considered and navigated. The challenge is that in kind of a very new and emerging field, it can be challenging to understand, like, how exactly do you do that? It's a lot easier for me to say here that I care about all these things. It's a lot more challenging to figure out how exactly this needs to happen. And I'll give a shout out here to a great ethical framework by Camille Nebecker and others at Recode Health. And that helped us kind of inform the concrete actions that we took here that I want to share next. So first, I believe it was critical to the success here to co-design the system with the various stakeholders, to understand the risks, to minimize the risks, to create any benefit. So we worked over many years with the designers of this platform, with the peer supporters and the users of this platforms, and with clinicians. Personally, I'm a computer scientist. You might have noticed that we're intervening on the peer supporter. We're trying to help the helpers. We're not intervening on the person acutely in crisis. That's a deliberate choice for how to do that with less risk. You might also have noticed that there's a very focused scope here on empathy, and we understand empathy and have studied empathy for decades. This isn't a general chatbot where we don't know what will happen, but it's very specifically designed for empathy feedback. We also kind of from the beginning of this project understood that there's kind of this really meaningful human-human connection happening on this platform. And there's absolutely a risk that if you kind of introduce an AI system in the middle, that you would kind of disrupt that meaningful connection. And that's, of course, not what we want to do here. In my world of computer science and machine learning, sometimes we call these things human in the loop. I think in the course of this project, we preferred calling this AI in the loop on a backseat with human supervision and felt more comfortable with that perspective. And kind of part of what the system is doing here, that it was designed to give minimal feedback and only if needed, to only pop up if there's kind of an opportunity for empathy here and not to do anything if that's, for instance, already expressed. We also made a deliberate choice of not to kind of answer fewer research questions with a lot more work. And specifically what we did is that we designed a kind of realistic looking sandbox environment instead of actually showing the responses yet to somebody on this Talk Live platform. We felt the right way to kind of progress in this line of work was to study the safety implications first. And for instance, we did that through that flagging button that I showed you earlier. And kind of with the kind of flagging, we're also using the same idea of kind of human-AI collaboration, where there's lots of algorithms behind the scenes that filter potentially inappropriate or unsafe content, but it also allows the peer supporter full control. It allows them to flag anything that might not be caught by these algorithms. And in doing that, also improve these systems over time. Now participants had access to a crisis hotline, could quit at any point. We did safety reviews of these systems at every stage over multiple years. Some of you might find it interesting that in the kind of exact AI objective functions, you can encode some of these ethical considerations, for instance, to kind of make the minimal changes needed in giving the feedback rather than kind of letting you write out a response and then I cross it all out, which seems like an amazingly effective way at invalidating people and making them less confident that they're good at supporting others. And of course, there was also informed consent and IRB approval. I think a lot of that is kind of what we needed to learn over the last couple of years, and it's pretty clear, similar to Ali's response earlier, that a lot more work is needed in this area on the kind of ethical principles in digital health and also the algorithmic approaches to ensure safety. I'll summarize and briefly look ahead, and then I very much look forward to the Q&A. I told you about empathy, that empathy is crucial, but a little bit more rare than we would like. And the work I showed here introduces new computational tasks and data sets and tools that can be used for facilitating empathic conversations based on state-of-the-art natural language processing techniques. We saw an RCT that shows that this human-AI collaboration approach can be effective. And this and other tools we've developed are actually already in use by several mental health organizations serving millions of people. So looking ahead, I believe that AI-based feedback could really help improve access and quality of mental health care, whether that's for peers or professionals. I think it could help improve with in-the-moment interventions like I showed you, but also help improve training programs to help us address the massive shortage in the mental health workforce here. And of course, we would focus on many more things and kind of things beyond empathy, like maybe cognitive reframing, complex reflections, building effective patient-provider relationships, psychoeducation, challenging health misinformation, and so on. If anybody's interested here, at this URL, you can find all the papers, models, data sets associated with this work. Big shout out to the amazing team that made this possible again, and I look forward to your questions. Thank you.